I'm Kristen Lodge. I'm the Director of Development and Communications here at the Wenatchee Valley Museum and Cultural Center. Welcome to the COVID vaccine Q&A session with the Chelan-Douglas Health District, Confluence Health, and CVCH. The Wenatchee Valley Museum and Cultural Center is located on the traditional homelands of the Piscosa, Wenatchee. We acknowledge the traditional lands and offer respect and gratitude to the Piscosa and to the diverse Indigenous peoples that reside in North Central Washington today. Our mission at the museum is to engage and educate in the Wenatchee Valley. Our museum also serves as a community forum, a place where you can meet your neighbors, learn about issues important to our community, and discuss your thoughts and opinions. While we're unable to gather at the museum right now, we're enjoying the opportunity to gather virtually in forums like this until we can be back together again in person. Our goal today is to provide our community with the opportunity to discuss public health and to get your questions answered about the COVID-19 vaccine, availability, locations, safety, and efficacy. Today, we have a Spanish translation provided by Martha with Claris Languages. If you're logged into Zoom, you have the option of listening to the translated audio channel, and you can do this by clicking on the icon of the globe and selecting the Spanish option. Leading today's conversation is Dr. Malcolm Butler, Health Officer with the Chelan-Douglas Health District, Joellen Colson, Senior Vice President and Vaccine Coordinator at Confluence Health, and Simon Mendoza from CVCH. Dr. Houck is also with us, a consultant out of the Washington State Department of Health, just back in town after doing good work in Columbia. I'll be on hand today to moderate today's session. We encourage you that are joining us via Zoom or Facebook Live to join in the discussion. If you're on Facebook Live, leave a question in the comments, or if you're joining us on Zoom, ask a question via chat or Q&A. I'll monitor your questions and do my best to make sure they get answered. I'd like to give our panelists the opportunity to share some information with you first, and then we'll open it up to your questions. Dr. Butler, let's begin with you. Thanks for being here today.
Thanks, Kristen. So a couple of things. On my end, I'm not seeing the globe like I usually do. So I'm not sure if other people, or any of the panelists seeing the interpretation globe?
No, I'm not either. We have staff on the back end from the museum who will be working to solve that problem.
Very good.
If we are unable to provide live translation, we will work to provide a translated edition of this published on our Facebook page and on YouTube, so you can check back with us.
Thank you. Then also, we are able to hear Martha as she is translating. It's coming through the same feed, and so I'm not sure if that's purposeful, but it may be difficult. So
we'll see if we can get that fixed for you too.
Right, thank you. So good afternoon, everybody. Good to be back with all of you. I wish I was sitting here telling you that all is well and that we're soon going to be out of the woods, and unfortunately that is not the case. We have started back into the fourth wave now of the pandemic. Our incidence has doubled since last month. We're now up above 230 per 100,000 per 14 days. This is almost certainly related to just a lot of increased mobility. As the weather has gotten nicer, people are getting out. It's likely related to youth athletics and other athletics where people are now gathering to have fun together. And it is related to the new variants, which are just more contagious than the older variant that we were used to. Excuse me, yesterday I got a call from the Washington State Department of Health informing me that there is now one confirmed case of the B117 variant in our district, Chelan-Douglas counties. So it's here for sure. We've been assuming that it was here, and now we know for sure it is here. So it's a race right now between getting people vaccinated and the increasing rates. We are hopeful that we've vaccinated the medically vulnerable, so the elderly. Starting today, we are starting to vaccinate people with chronic medical conditions, so that's huge. And what I can also tell you is that really a lot of the constraints around who we can vaccinate have been dropped. I think this Washington State has recognized that the most important thing is just getting vaccine into arms. And if people are very enthusiastic about getting vaccinated, we'll find a way to make that happen. Those are the end of my comments, Kristen.
Thank you. Joellen, would you like to give us an update from Confluence Health on vaccine availability?
Sure. Vaccine supply has continued to increase throughout Washington state. This week, the state as a whole received about 408,000 doses, and 238,000 of those are for first shots. So in total in Washington state, 3.25 million doses have been given. That is great news. That is cause for optimism. So about 27% of Washington residents have received at least one dose. Our numbers look great here in Chelan County. We'd like to see them even higher, and we're so excited about the opening eligibility that went live today. In Chelan County, we see almost 37% of our population has received their first dose. So that is great news. I do want to share that one of the items that might have been a previous barrier to vaccination was phase finder. Just that the technical need to go into a system and prove your eligibility, and effective today, proof of phase finder eligibility is no longer required. So today, additional groups are eligible, including in all people 60 years and up, people 16 years or older with 2 or more comorbidities or underlying conditions, and then large groups of employed individuals, including critical workers in congregate settings, restaurants, food services, manufacturing, and construction. We also see that congregate living facilities are covered, our jails, our homeless shelters, group homes for individuals with disabilities, and even those places where individuals access services. So all of this is really good news. We anticipate that vaccine appointment slots will be filled, whether at Town Toyota Center, Confluence Health, Columbia Valley, or a variety of settings. All of the regional healthcare partners continue to work together to ensure that we have outreach to our most vulnerable populations. So happy to meet Simon on the call today and know of his outreach to our H2A and other agricultural workers. That is definitely a workforce that that everyone has been reaching out to, including Confluence Health.
Great, thanks. Good transition. Let's go ahead and hear from Simon about your work.
My name is Simon Mendoza. I am a PA with Columbia Valley Community Health. I've been there for nearly 5 years now and recently transitioned to starting our new mobile clinic. So we're going out to the surrounding towns, Orondo, Shaston, Rock Island, and we're also aiming to vaccinate all the H2A workers once they arrive later this spring. And we're also focusing our vaccination efforts on the packing sheds, trying to vaccinate all the employees at once. And it's really great to be here.
Thanks for joining us. And Dr. Houck, oh, go ahead.
Simon, share the story. You had a patient the other day who arrived at your clinic, not by foot and not by car.
But 2 different horses that he brought. So he came up riding his horse in Rock Island, and that just made our day. So
I love it. That's fun. That's old school.
yeah.
Dr. Houck, how about you? I understand you just got back in town. Tell us about your travels and your work.
Yes, thank you. Actually, I just got back from the country yesterday. I was in Colombia in South America for about 2 weeks. I've been working there off and on for several years. Got run out of Colombia last March when COVID really flared and they shut the country down, including all the air travel. So this is the first time I've been back. And even though I've been gone the last 2 weeks, I've been paying attention as best I can to what's been going on in Chelan and Douglas counties in the state. And it makes me feel good to see how well things are going vaccination-wise. And again, I think you can thank all the groups that have been involved in running the vaccine programs, as well as the people in the community who are, as I said, rolling up their sleeves and getting the shots. I think it's going to make a huge difference. I'll just give you an example. As Dr. Butler said, it appears we may be sliding into the fourth wave. Numbers are going up all over the country, and it's happening as well in the state and in our 2 counties. But if you believe the mathematical modeling, of which it looks like there must be hundreds of people doing modeling, predicting what might happen over the next couple of months, it's interesting that all of the models for the state of Washington and for Chelan County and Douglas County show a predicted increase over the next month or so. But the good news is all those models also show it coming back down after not going too high. Now, compare that with Colombia. Colombia got its first doses of vaccine the middle of February, and they've been having difficulties that make our early problems look relatively easy. The predictions for the pandemic in Colombia are that the peak may very well go almost as high, if not higher, than the one we just had for the 3rd surge. So, things could be a whole lot worse. And I think the reason they might be much better here is A, people are being really careful, and B, we have much more vaccine than many other countries do. So be thankful for that. Be thankful for the work of the health district and all the partners who are trying to get vaccine out, and keep up the good work, hopefully the good work of wearing masks and maintaining distance and all those things that we know are effective in preventing transmission. It really is important, and it'll pay off in the end.
Great. Thank you all for providing that update. Joellen and Simon, I appreciate that you spoke to who has access to the vaccine right now, and the change up in the phase finder eligibility. Can you tell us within the community how those who are eligible get signed up and where they should go to get vaccinated?
Absolutely. So from a Confluence Health standpoint, you can call 509-663-8711. We have clinics Thursday, Friday, and Saturday. The health district and the town Toyota Center are changing up their hours. We're very excited about that because it will allow people who have kind of an 8-to-5 job additional extended hours in the evening. So Town Toyota is moving to 11 a.m. to 7 p.m. Monday through Thursday, and Friday 9 a.m. to 5 p.m. The Town Toyota also does have a line for individuals that need language assistance to ensure that anyone can make those appointments. So the health district number is 886-6487. And that is the outreach number in case people want to register their workforces, including agricultural workers. Let's see, Malcolm, do you know the number for the Town Toyota right off the top of your head? I don't either. I don't have that at my...
We can ask the staff from the museum to look that number up and to list all of those in chat, both on Zoom and on Facebook.
Thank you.
Great.
Simon, would you speak to vaccine equity? Can you tell us about how we're mitigating inequities and helping reach those in the community who might need it the most? Simon, I believe you're on mute.
So I think we're doing a much better job. There were some concerns early on, with the phase finder requiring an email. It was very difficult to get my patients signed up, the majority not having an email. So I think we're doing a much better job now. I think focusing on vaccinating all the employees at a packing shed is a great strategy, because that's one of the most common areas of infection. These workers working in close proximity to one another. I think that also so we're anticipating, the H2A workers as well, and planning those vaccination efforts are all helping to mitigate those gaps. And so I think we're doing a much better job overall. There's a lot of work still to be done, and I'm looking forward to it.
Great, thank you.
Well, I have a question for Simon. First, I'll just say that if you are interested in being vaccinated at Columbia Valley Community Health, 509-662-6000, and just explain in either English or Spanish that you're interested in finding a vaccination slot. Simon, it strikes me that a migrant workforce is going to be difficult to vaccinate with a vaccine that requires 2 shots. So how are you going to know if you go out and vaccinate a migrant workforce that they'll be available to receive that second shot?
So we're working very closely with the employers, and we want to schedule both vaccines when we do reach out to these employers to ensure that they get both vaccines. Or the other option would just be to offer the Johnson & Johnson vaccine to those workers. I think that's another viable option.
Is that vaccine available in our community at this time?
Yes. We are, we're having a small event tomorrow with Cafe, where we're vaccinating. We have 20 slots for the Johnson & Johnson vaccine there. So, yeah.
With, as it comes to Pfizer and Moderna, how important is it to receive that second shot?
Is this a question for me, or?
I'll let any of you take it. First dibs.
Yeah, I think how important is it? I would say it is very important. If you don't get the second shot, nothing bad will happen to you. And so I would say probably 2/3 of the impact come with the first dose, and another third comes with the second dose, but probably the longevity of the immunity has a lot to do with that second dose. And so if you want to be immune for as long as possible, then that second dose becomes super important.
Let's talk a little bit about the vaccine as it relates to variants. How effective are the vaccine in fighting the virus variants we're seeing in the community? And do you anticipate that we'll be needing boosters as the virus continues to mutate?
I'm going to give that one to Dr. Houck.
Thank you. And by the way, I agree with what Dr. Butler said about that previous question. So far, all the evidence I've seen is that all 3 of the vaccines we now have available are effective against the major variants. Even if they might be less effective a bit in preventing mild disease, they're still extraordinarily effective in preventing serious disease and death, which of course are the things we most want to prevent. Everything I've seen suggests that they reduce the transmissibility of viruses, regardless of the variant. So I think that's extraordinarily good news. I don't think right now we have to worry about them becoming ineffective. Now, the question about boosters or a yearly immunization, just like with the influenza vaccine, I still think that is probably likely to be the case in the future. Now, Dr. Butler, I'll open this. Well, actually, I'll open up for all of you. But I think this coronavirus is going to be around for a long time. And I think we're going to have to continue having updates on our immunization. That's my guess. I've heard many people who are far smarter than I am say the same thing. So that's where I think we're going. But I think right now we're in pretty good shape with the variants that we've seen. Malcolm, what do you think?
Yeah, no, I agree. I think we're going to be receiving boosters on a regular basis for a good long time. There's an analogy I like to make about the vaccine and how it protects us. So imagine, we talk a lot about different mitigation strategies, right? Different things we have to keep us safe from coronavirus. or COVID-19. A huge one is a mask, also hand washing, spreading apart, not gathering, and vaccinations, right, is one more. So let's imagine that COVID-19 is a rainstorm and the vaccination is a raincoat. So if you have a good quality raincoat, it's going to keep you dry when you're out in a heavy rainstorm. And these variants are a heavy rainstorm with some pretty strong wind, right? So if you go out, say, in a downpour and a squall with that same raincoat, you might still get wet, but you're not going to get drenched through to the skin, right? You're still going to have a pretty good amount of protection. And that's what Dr. Houck is saying. And I think it's hard for me to understand because I've always thought of vaccines as not allowing the infection inside my body. And so how can it possibly be that, yes, I can get infected, but there's more to it than that? And the more to it than that is the vaccines will keep your immune system from going bonkers and putting you in the hospital. And so this COVID-19 is very interesting. Some people get sick, but the people who get really, really sick, their immune system gets involved and gets confused. And so these vaccines, yes, you might get sick, but the chances of you ending up in hospital are very small. And the chances of you dying are very, very small. And so, yes, even if the new variants are like a hurricane, if you will, and even if some of that's going to break through a pretty darn good raincoat, you're not going to end up drowning. So we do encourage everybody to get vaccinated, especially because these new variants are here, because there is now evidence, especially with the UK variant, the B117, that it is actually more dangerous than the Wuhan or the original variant. We didn't have that information a couple of weeks ago, but we do now. People are getting sicker and younger people are getting sicker. So now in Europe, and in Michigan, I understand the people being hospitalized are younger. That may be because we've done a good job vaccinating the older people, so they're being protected and not ending up in the hospital. But these new variants are more contagious and more dangerous. So please get vaccinated.
Let's talk a little bit about the fourth wave that you've told us about and that we're hearing about in the news. Can you tell us about the cases in our community and whether it's cause for concern? Vaccinations are rising, as you said, but fast enough?
Yeah, well, as I mentioned, I think we're in a race, and we're in a race between getting people immunized and thus protected, and how much how much the virus is going to be able to move itself between humans. So if we completely lock down the economy and nobody was allowed to leave their homes and we shut down the schools, we could shut down the fourth wave. But we've decided that there are enormous health detriments to doing those things. Shutting down the economy is bad for all of us. Shutting down the schools is bad for most of us. And so we're in this tug of war where we have to keep the economy and the schools open. And yet when we do that, the virus has an opportunity to move back and forth. So it's just incredibly important right now that everybody's doubling down on their masking and on their distancing, that you're not gathering in groups, that if your kids are part of a volleyball team, you don't have them all over for dinner and a sleepover, that when we go to church, we're not hanging around afterwards without our masks on, and that if we're going to meet people together, we're going to do it outside now that it's getting a little bit warmer, and that we are all, as soon as we are allowed, getting down and getting vaccinated. So yes, I am worried about this. I'm not as worried as I was when our hospital was overwhelmed and when our healthcare workers were burning out and falling down. So, you know, I'm not as worried about people perishing, but I'm very worried that we're going to move back a phase and we're going to have to shut down our economy and close down our schools again.
Can we talk a little bit more about that phase 3? Are we looking at phase 3 as perhaps what's causing this fourth wave or this spike in cases?
Yeah, that's an interesting question. No, we're not. The spike started probably, we came down to the very bottom, our lowest around the beginning of March. And if you remember, the governor opened the economy, I think it was the 22nd of March when we moved to phase 3. So really, I think that change is contributing, but really I think it's about the mobility. But think about it. If there's no reason to leave your house, so if you can't go out to the stores, if you can't go out to school, if you're forced to stay home and work from home, you're going to stay home. But since all of those things went away, now we're all leaving. And as we leave, we intermingle with other households. And so it is increasing mobility, which is related to the fact that we were coming down the third wave and employers started relaxing their imperatives. The fact that the weather is nicer and now it feels more like we should be having barbecues and things like that. And then again, these new variants, which are here and just seem to be stickier, and they get on us and they won't go away. But I don't think it's, I think the impact so far of phase 3 is small. But again, my opinion doesn't matter all that much because the governor has already said, if on April 12th, we're above 200 per 100,000 per 14 days, we're going back. And I think that's almost a certainty at this point. I could be wrong, but it seems most likely that we're going to go back.
Kristen, can I say something about that?
Absolutely.
I think that, and this is my opinion, maybe a little bit educated, but I think that when all of this is over, we're going to look back and say, gosh, we wish we would have shut the whole thing down really tightly for about a month back in March or April of 2020. And part of the reason why I say that is that it seems every time we loosen things up, the numbers go back up. And I'll go to Colombia for an example. Last March 9th of 2020, I arrived in Bogota, and they had things screwed down really tight already. I was really impressed by what they were doing because it was so much more than we were doing here. But they relaxed everything really quickly too. Their numbers went way back up. They've been on this roller coaster now for over a year, and they're doing the same thing now. And I think they're seeing some of the risk of doing that sort of thing. And again, I think when people do the after game analysis of all this, we're going to wish that, and it probably would have been a whole lot less expensive to have simply shut things down tight for a month than to do this sort of on again, off again thing we've seen. Malcolm, any thoughts? Any of you have thoughts? Malcolm, especially you.
Yeah, armchair quarterbacking is tough. But yeah, I mean, I agree. In retrospect, it's that issue of you got so close, but you didn't quite stick it out. But again, back then, companies were dying. We didn't know that the government was going to be pouring $2 billion into the recovery effort and everything else. So, but I think it's a good model to bear in mind, which is if we can just stay home as much as possible, that's good for everything. And if you need to zip out to the grocery store, do it, but then go home and try and stay home. It's just a worrisome time right now for us to feel at liberty. And I've said this before, as soon as we loosen things up, people who don't listen to Facebook Live and the Wenatchee Valley Museum, people who don't read the newspaper, they just see, oh, it's better now. We can go about our business. And that's where we get into trouble. So shutting down the economy, on the one hand, does keep people at home, but it also rings the bell. It makes a loud noise where people understand, uh-oh, there's still a problem. Yeah, so I think we have to do that. But yes, Peter, I think it's a fair point, but it's too late now.
Oh yeah, and again, as you describe it, armchair quarterbacking is neither dangerous nor fair. But I think it might be a lesson that we learn and perhaps can apply to the next pandemic, which we will probably come again. Maybe not in our lifetimes, but I think it'll come again. But it's difficult because let's just think back to last April or May or June of 2020. And as you say, businesses were closing, they were dropping like flies, and we probably couldn't sustain that. But I'm not an economist either, but I'm just wondering if when all is said and done, it wouldn't have been less expensive to do it a little bit longer than let up, as you say, just before we cross the goal line. I don't know. That's my thought, though.
Let's expand on this a little bit as we talk a bit about reopening. Let's focus for a minute on children. The Wenatchee School District announced last week that K through 5th grade students will return to school full-time with 3 feet distancing, which just follows the CDC and Washington State Department of Health's approval to reduce the 6-foot distancing for children to 3 feet. Have we seen the science to support these changes? And can you talk a little bit about the health districts and the hospital's recommendation when it comes to the return to in-person learning for our students?
Yeah. So you asked several questions there, and I'm going to deviate a little bit from your questions. And that is, when we don't have very good science, what we need to do are, multiple small experiments. We have to try something, see if it works. As long as it looks safe, then we go the next step, make sure that's safe, then we go the next step. And that's what we've been doing with our schools. Back in May, when we were starting to think about how we might reopen schools, we started looking back at influenza pandemics and how they were doing things in Europe. And we came out with the knowledge that we should open schools when the numbers are below 25 per 100,000. And maybe we could open them in some limited way up to about 150 per 100,000, but after that we had to shut down the schools. And over time, we've just proven that was wrong. That was just a reasonable effort at the time, but we've proven that it was wrong because we have had kids and educators back in classrooms safely with the local incidence at above 1,000, not 25, 1,000. So what we have to do going forward is we have to use the best evidence we have, and then we have to make an effort. And if we see any evidence that there's transmission happening inside the schools, we got to shut it down and go back to where we were. And so that's the plan that the schools have right now. The evidence is that school districts who have allowed a 3-foot separation have done exactly the same as school districts that have required a 6-foot separation, as long as there is very careful attention to masking and hand washing and everything else. It is really easy, again, for people to say, oh, we can have everybody back now, let's just relax because it's probably not a big deal, and then everything falls apart. So you have to be absolutely scrupulous in what that means. I'm sure all of you have been out in public and you've seen people wearing a face shield and no mask, and their employer feels that that is adequate. That is absolutely inadequate, and we do not allow that in the schools because we're trying to keep our kids safe. If you're wearing a face shield in a school, you need to have a drape above and below that won't let any of the exhaled air out. There are rare situations, very special need kids who, for example, are on a ventilator or, can't otherwise wear a mask. And in that case, the staff who are educating them need to be in what we call PPE, right? Full PPE. So yes, the health district is fully supportive of getting more kids back into classrooms. I do not believe that it is about 3 feet of separation. It's about the number of lungs we have breathing in a classroom. Now, if you think about it, 6 feet and 3 feet adjust the density of students, right? You can have twice as many students inside that classroom if they're allowed to move their desks closer together. But what I'm worried about is having all of those lungs breathing in the classroom for 4 hours or 5 hours and what that means. And so we're working on that. We're working hard on ventilation. We've got strategies in place so that if we see any evidence of transmission, we're going to shut everything down and we're going to go back and figure out where the mitigation strategies broke down. And then to be clear, it's only the elementary schools that Wenatchee has said are going back. And that's because elementary schools are much easier to constrain. We can keep all the kids in the same classroom and the kids aren't wandering around from room to room in the hallways. In middle school and high school, we cannot do that. So we're going to start largely in the elementary schools and make sure it can be done safely and learn from those experiences and then potentially expand it. Now, I know there are some school districts where they are able to what we call cohort, or keep groups of kids together, even in middle school and high school. And in those situations, and they may be trying that too in some of the smaller school districts. But yeah, I do want to reassure everybody that the schools are being incredibly thoughtful about this. They're taking little baby steps, and they're making sure that everything is safe before they move on. Because as has been true throughout this pandemic, there is not enough research or science to know exactly what is the right amount of safety to impose. I suspect we're 5 times higher on our safety measures than we need to be, but we'd much rather be 5 times higher than not quite high enough. And importantly, all of the evidence since last September is that kids and educators are safer in class, safer on campus than they are at home. It's very clear kids are safer on campus than they are at home as far as COVID goes.
Can you update us a bit on vaccine development and testing for children? We saw yesterday that Pfizer announced their vaccine is safe for children 12 and under. How long before we see that number move to all children?
You want to take a guess at that, Peter?
Sometime in the next year. And that's really just a guess. I think we will. What I know about the vaccine technology suggests to me that there's really no difference between the immune response that you're likely to get with an adult or a 16-year-old, so it goes down to 16 now, and a 5-year-old. Probably where it gets a little bizarre is in the infant, the less than 1-year-old, especially the really young ones, where you may have issues with antibody from the mother and things of that nature. I think we'll know within probably 6 months. I guess, but the question that goes along with that is, will the vaccine supply allow us to go down to a year or whatever? And in this country, I suspect it probably will be. But in the rest of the world, I don't think it's going to happen for a long, long time. Not only the supply of manufactured vaccine, but the distribution systems. Despite our problems, we're doing, I think, pretty well compared to most of the world.
And I agree with all that. And yeah, it's totally a guess. It would be fabulous if we could have vaccinations for school-age kids by next fall for the start of school. I want to tell a little bit of a story as to why it's important. We hear people saying, gosh, kids don't seem to get very sick. And so why are we bothering? And it's an experimental vaccine. And shouldn't we protect our young people? So I want to tell a story about other illnesses that we have vaccines for. And so whooping cough, right, which is pertussis is the medical term. Whooping cough is like lethal in babies. And what we have discovered is that whooping cough in adults isn't a big deal at all. It's just a little cough and we get over it in a week or two, but it can kill a newborn. And so about 5 years ago, we started vaccinating all mothers and fathers while the mother was pregnant against whooping cough. And we did that to protect the children. Does that make sense? Because mother could just get a cough and it's no big deal, but she passes it to her newborn and the newborn dies because they were too young to be vaccinated. And I think in a similar way, we need to start thinking about the populations that we are vaccinating and how we are protecting other populations. And so vaccinating children against a disease that's lethal in their grandparents is a good idea. Not only because we want to keep the children safe, but because we also want to keep the grandparents safe, right? And sort of similar to that, think about what's happening right now. We vaccinated everybody, say, over the age of 65. So most of those people have immunity, and the virus is not going to be living in people over the age of 65. And where we know most of the virus is living right now are in adults between the ages of about 20 and 50. Throughout the pandemic, they're the folks who've been most infected. They aren't the ones who've gotten the sickest or died, but they've carried most of it. And in pandemic type of thinking, we think about a reservoir. So you imagine a reservoir full of water that we use to irrigate our fields, or you're driving over Snoqualmie Pass and you know all the reservoirs up at the top there are used to irrigate all of the Yakima Valley. So there is a reservoir for the vaccine, for the virus. The virus. And so in our communities, there's a reservoir of, and so that's all the people who are not immune. That's the place where the virus is hanging out and reproducing, right? And so the reservoir right now are in parents, adults ages 20 to 50. Typically, that's the age of the parents of our kids who are in schools. And so if we really want to get our schools reopened, we need to remove that reservoir. We've got to vaccinate all of those people ages 20 to 50 so that the virus has nowhere to hide and reproduce. And those people aged 20 to 50 may say, I don't want to get vaccinated. I'm not going to get very sick or die. It's no big deal. But my point is, we have to get rid of the reservoir so that we can reopen the economy and make sure that all those kids of those parents can get back into schools. So this idea of vaccinating one age group so that we can do things with another age group is an important one to consider, and it's one we haven't spoken about very much.
Thank you for that. We see this question pop up frequently as we have these conversations, and particularly on social media. As we chat about this, let's talk a little bit about vaccine safety. Is it safe for those in the general population with and without underlying conditions to get the vaccine?
All the doctors are nodding their heads saying yes. So I've said this before, and it is true. This vaccine, as far as we can tell, and in the state of Washington, over 3 million people have received it. In the United States, tens of millions of people have now been, well, no, I'm sorry, over 100 million, right? We got that by Biden's 54th day. Over 100 million people have been vaccinated. So we now are very, very, very confident about the safety of this vaccine. This vaccine is safer than water. More people have drowned in the last 6 months than have had a bad outcome from this vaccine. Some people have allergic reactions, a very small number, maybe 1 for every 10,000 doses we give. And that allergic reaction we know how to manage. There have been, over the course of time, strange issues that have happened, but we have not consistently been able to find any damage or any long-term side effect of giving this vaccine. So this vaccine is safer than water, and COVID is way more dangerous than water. So it's hard for people to trust, but as these numbers get really, really high, it's just impossible to ignore how incredibly safe these vaccines are.
This technology has been around for about 20 years. You know, they've used it in the development of other vaccines like rabies and Ebola. And it's really a lot safer than other vaccines that are already have been approved for several years. So I think that's one thing that comes up a lot is people worry about how rapidly it was developed, but the technology has been there for a couple of decades.
Yeah, I might add one thing. I agree totally with both of you on that. I think an interesting thing, and I remember talking. I think we talked about this the first one of these sessions, the last one I was able to participate in. The 3 vaccines we have now, after millions and millions and millions of doses, there just hasn't been anything that I'm aware of to worry about. The issue of anaphylactic reactions was, as Malcolm pointed out many, many times during our previous discussions, that's really scary to watch if you don't realize that it's actually really, really easy to treat. And so that's really not an issue. I think that this recent issue with AstraZeneca vaccine, which we are not using in this country yet, in Europe with these sort of strange blood clots, is just an example of how actually how good the surveillance system is for finding these rare adverse events long after the vaccine is introduced or any drug is introduced. And keep in mind that even the incidence of these weird blood clots is pretty darn low. I think the last I saw was like 1 in 100 or 150,000. So it's pretty rare. Not inconsequential, but with the 3 vaccines we now have available in the US, I don't think there are any issues. And I don't think anaphylaxis is in reality a real issue. It's scary, but as Malcolm has pointed out, it's really easily treatable. And everybody knows how to do it.
Yeah, when we're giving the the vaccines on site, I observe you for 15 minutes. If you've ever had a reaction before, we'll observe you longer, 30 minutes. We have all the medications at our disposal to treat any minor and major side effects, but overall it's extremely safe.
Thank you for speaking to that. We see that question pop up a lot. As we talk a little bit about the 4th wave and phase 3 in our community and things reopening, we're also looking at spring break happening next week. Is it safe to travel? And do you have advice for people who are planning to travel on ways they can stay safe and reduce the spread?
Maybe I should comment on this, since I just got off an airplane after, I think,
thinking this might be a good one.
9
for you.
I was on 9 flights in the last 2 weeks, and my first of all, air travel in general, airplanes, the airplanes I believe are inherently safe when you're thinking about infectious diseases. The air supply is really pretty darn good, even if no one's wearing a mask. Probably your biggest risk is that tray table has all kinds of stuff on it you don't know about. But I watched the airlines. It was American, Avianca, and LATAM in Latin America, and they were pretty darn careful about what they were doing. Everybody on every one of the 9 airplanes I flew on, everybody was wearing a mask. I didn't see anybody who was messing around, who was being sloppy. They were really, really careful. So I think the aircraft cabin environment is actually quite safe. All the airports I went to, which were 3 in the United States and 4 in Latin America, man, especially in Latin America, they were really strict. There were signs everywhere. If you didn't, now this didn't happen to me, but I did see people say, "No, please put your mask on." That was in Spanish. I think it's safe. Now, where I don't think it's safe is to go to Miami Beach or Southern California and hang out on the beach with a bunch of people you may or may not know and not wear a mask and not maintain some distance. That I think is dangerous, and that I think is going to cause us some problems over the next month. And I think people should avoid that. But that's not the air travel itself. That's what happens when you get to the other end. Any thoughts on? I mean, I don't know if anybody else is. I'm not going on spring break.
No, I agree. I think it's it's all the things that go along with travel, right? So frankly, if you are just traveling from here to Portland, if you're riding in a car or a bus with other people who are not inside your bubble, that's dangerous. Being inside a vehicle for 6 hours, with even wearing a mask, ain't a great idea. Wearing a mask is going to help a lot. So those kind of things. And then as Peter is pointing out, we travel to have fun. So we're likely to go drinking. And when we drink, we're likely to socialize. And we're likely to let down our guard a little bit and that sort of thing. I think it is possible to be as safe on vacation as you are at home. You just have to make careful choices. And so, yes, I think it can be done safely. I've received plenty of questions from the schools and from employers basically saying, what should I do when I know somebody has traveled to Miami Beach? Should I let them back in school or back in the workplace? And the short answer to that is, if you are at all worried, you should ask that individual to get tested. Now, I'm aware, I don't know, Peter, if you had to get tested coming back into the United States?
Yes, actually, you have to, going into Colombia, you had to have a PCR test within 96 hours before you left. In this case, before I left Miami. Coming back into the US, you have to have a negative either PCR, antigen, or rapid test during the 3 days prior to the day you traveled. So it's essentially the same thing. You have to have a negative test.
Yeah. And so I think if people are worried, they should ask people who have traveled to get tested. A PCR test is the best for that if you don't have symptoms. And then I think if that's negative, you're okay. You could make the case that, you know, if you're working in a long-term care facility with high-risk individuals who aren't vaccinated, you should probably wait 5 days and then get tested, sort of thing. But yeah, overall, I think that travel by itself is not a big deal. It's what you do on vacation that's a much bigger deal. And if you want to be safe, get tested after you get back to make sure you didn't pick up anything. You didn't bring home anything you didn't mean to bring home.
Yeah, and I'll add, I'm in self-imposed quarantine right now, and I'll be tested in the next couple of days, just to be sure. Though I think the chances are pretty low. And again, as Malcolm said, it's what you do, not necessarily where you go. You can put yourself probably in as much risk by getting together with 20 people in Chelan as you would be getting together with 20 people in Miami Beach, more or less. I think it's the gathering, it's the closeness with people who are not doing the right thing that puts you at risk, I think.
Thank you for speaking to that. I see that we're nearing the end of our hour, and I'd like to invite each of you to share your closing thoughts regarding the vaccine, the virus, or perhaps your advice for us as we stand at the beginning of the fourth wave, or as vaccination ability improves, or as we may reach the beginning of the new normal here in the Valley.
We are so close to seeing the end of this pandemic. I think we should all try our best to buckle down and try our best to reach herd immunity in our community, and then return to normal. I think there's a lot to look forward to, but we have to put in the work and buckle down and control this fourth wave.
Thank you, Simon.
That's the same thing. I agree with that 1000%. It's the same thing I've said for months and months. We can't let up yet. It's just a little bit early to declare victory and party on. Keep doing the right thing.
Yeah, I think well said, Dr. Houck and Simon. I can only echo the importance of receiving vaccine and continuing to wear a mask so that we can all do our part to end the pandemic. We are hopeful that eligibility will continue to open up even earlier than May 1st. So in Washington State, if that eligibility happens, then we are ready to get shots in arms, wherever you're located.
And I would just like to thank everybody on this call. I'd like to thank Kristen and the staff at the museum for bringing good information out to the community. I'd like to thank Joellen for all of the work that Confluence has done. I cannot, it would take a long time for me to explain all of the great work that Confluence has done. I'd like to thank Simon and his team for taking it out where we need it, into small work sites and remote places. Thank Dr. Houck for his help and expertise over time. And I agree. Nobody on this call wants this pandemic to go on one day longer than it needs to. We are so ready to be done. I rip my mask off as soon as I walk out of my clinic, and I try not to put it on until I come back the next day. I hate that dang thing, and I'm still going to wear it.
Thank you all. Good. Well, I recognize that the virus and its effects have been polarizing for our community, especially for our local businesses and our economy, as you spoke to, and the ever-changing and updating information as we learn more about the virus and the vaccine and our restrictions. And I want to thank each of you, Dr. Butler, Joellen, Simon, and Dr. Houck, for the opportunity to learn about public health in our community, the COVID vaccine, and the hope it offers in shielding our community from the effects of the virus. To our participants, I want to thank you for your constructive and productive questions. I invite you to join us at the museum. All galleries at the Wenatchee Valley Museum are open Tuesday through Saturday from 10 to 4 at 25% capacity. We also have engaging events coming up online and in person. We have one space left in our in-person spring break camps for grades 2 and 3, a makerspace to go class where you can learn to make earrings at home, and upcoming environmental films and tastings in support of local businesses. Learn more and join us at WenatcheeValleyMuseum.org. Thank you again for joining us today. We look forward to seeing you again soon.
Thanks, Kristen.
Thanks very much.